The Medical Home Initiative has always been proactive in assisting individuals, families, to get the right care at the right time in the right place. And so what the Medical Home Initiative does is begins to work with children and families in terms of identifying what services they need in the community as well as what they need medically. What's really special about the Medical Home Initiative is that they take the extra time to work with the individual child as they become adolescent and young adult to make sure that they understand their medical care, to make sure they know what their medications are, and to make sure that they can become competent in their own care.
Growing up in healthcare and more intensive healthcare leads you to this perception of yourself as always the patient, and your parents are the ones who, manage your care, and you do what your parents tell you, you do what your doctors tell you. And then as you get older, it gets more confusing as you're going back and forth between being a kid and being an adult, and how that changes how you view your responsibility and where you belong in healthcare. And so when I got to adult healthcare, I thought that I was independent. I thought that I had learned what I needed to know and how to take care of myself. But that moment when my adult gastroenterologist said, look, I don't care what your dad has to say, he needs to leave so that I can talk to you, was a wake-up call for me. And I think that if I had been a part of or been involved with the Medical Homes Initiative, having more comprehensive preparation and a summary and practice, getting ready to take care of myself and be independent would have been particularly useful. I think that it's really important to have something like the Medical Homes Initiative around because it builds a foundation for adolescents and young adults as they move towards transition and transfer of care, rather than it being this sort of abrupt moment of switching providers, going to college, getting a job, whatever it may be. All of the parts of your life that happen when you become a young adult, having that preparation ahead of time, having support and summaries and staff that you know well and are comfortable with, who help you get ready to be a productive young adult, not only in your healthcare, but also just overall in life.
Having a medical practice as a medical home really allows the youth and the family to have the support they need to get all the services that they're either entitled to or eligible for. And that's why I think every practice, pediatric practice, should be a medical home. And frankly, I think adult primary care practices should be medical homes as well.